Hello everyone, Josh and Paige here, and this is our presentation on common orthopedic problems in the geriatric population. So first we want to start off with our objectives. And number one is to understand the multidimensional challenge of treating the geriatric population. So a few points here. First of all, they have habits and lifestyles that they've been practicing since before most of us were, actually all of us were born. So when we go to have those kind of health and wellness conversations with these patients, it is going to be very difficult. We're going to have to provide all kinds of evidence for why they should change what they've been doing for many, many years. Secondly, when treating this population, we must be on our toes and really ready for anything. They could walk in the door with chronic pain, comorbidities, neuromuscular, psychological, cardiovascular, any type of other system involvement with their musculoskeletal injury. And this will just prove to be that multidimensional challenge. Also, more than I think any other patient, we must treat their whole system. We can't just treat one specific muscle, one specific joint. It really is mandatory for us to treat their whole body and really provide the best type of treatments for whatever they're coming in for. Second objective is to discuss common orthopedic problems specific to this population. So these are shoulder pain, knee pain, low back pain, hip fractures, and then joint replacements for those joints that's common in. And within each of those categories, we will unpack the different types, risk factors, and treatments for each of these different impairments and issues that this population deals with. And ultimately, the goal is to use the different articles and evidence-based practice to have the maximal effect on our patients, and as my guy over here on the right says, gain some knowledge. So next, we'll go into some general info about this population, which Dr. Smith went into very well this week in our lectures. But the population of people over the age of 65 is growing rapidly. By 2050, it's going to be 22% of people, which is one out of every 5 people. That is a staggering amount. Elderly individuals living alone is increasing. The geriatric population is staying active longer. People above the age of 65 are working longer, and there are increasing rates of obesity in our country. So why does that matter? What does this mean for us? Really, it's going to show that these people are getting injured. They need physical therapy to maintain their quality of life, to maintain their ability to work and do what they love and live alone and stay active and independent. So this really is huge for us to be able to grab a hold of, to gain knowledge about, and to really inform our practice to really become the best PTs that we can possibly be. So I hope you enjoy this presentation, and we'll go on to the next video.